Good morning, everyone. As Diane said, my name is Emily Armstrong, and I'm the lab manager at the Rehab Robotics Lab at the University of Alberta. And I also manage one of our projects, Promote. So today I'll be discussing community care and how we can use technology to help enhance care in rural communities. I also want to acknowledge that I am presenting to you today from Treaty 6 territory here in Edmonton, but that our work with this project spans many rural communities and traditional lands of many Indigenous groups in which we are privileged to continue our work. Promote is the culmination of 3.5 years of research in telehealth. That's right, we predated COVID. But now Promote is redefining assessment and expanding accessibility for those who reside in rural communities. This process and innovation project allows patients to receive the care of a specialist hub clinician while being supported by a local spoke clinician through our clinic-to-clinic model. And what this means for patients is that they're able to receive care which is equivalent or better than that of an in-person assessment, all while remaining in their community so they can be surrounded by their support network. Patients also benefit from the reduced organizational efforts, stress, and personal costs of in-person specialist appointments usually entail. To enable our clinicians to do this amazing work from hundreds of kilometers away, we need to use a lot of technology. KinetiSense's markerless motion capture software allows clinicians to easily track and measure movements and angles, such as the patient's range of motion or sway during a balance assessment. These measurements mean that smaller changes can be seen over time than with in-person assessments. The TEMI and double robots enable hub clinicians to safely navigate the assessment space without having to interrupt or be moved around by the spoke clinician to see what they need to see and build rapport with the patient. This is essentially telepresence. And the vestibular infrared goggles allow for a clinician to get a closer look at eye movements, which could indicate a vestibular disorder. These goggles block all incoming light, and the infrared camera enables the clinician to view these eye movements when the patient is in total darkness. We're developing and collecting more technologies and sensors as we build out new modules, but these are the main ones that we use right now. But what does any of this have to do with pain management? Well, in rural communities, chronic pain incidence rates are higher than the average. In Canada, 1 in 5 people live with chronic pain, and in Alberta, 11% of the population reports suffering from chronic pain. And these numbers are projected to increase as our population ages. Research shows that a multidisciplinary approach to chronic pain is the most clinically and cost-effective treatment, but for many rural patients, this is out of reach. Rural patients face significant barriers to care. The need to travel to appointments means time off work, arranging childcare, personal costs, and time spent on the road, and in some cases, overnight in a hotel. It means that patients have to make an uncomfortable trip while in pain, and they're separated from their support network. To give you an idea of the cost that these rural patients have to face, I've included an excerpt from a study by Watanabe and colleagues back in 2013. This was a pilot study for rural Albertan cancer patients which received care through video conferencing. And you can see here how much of a difference virtual care can make for a patient. These numbers, 471.13 kilometers, 7.96 hours, and $192.71 represent the cost of just one visit. And keep in mind, this was 2013, that's about 10 years ago. And the gas prices were, 70 cents a liter back then. So I think that the costs have significantly increased today, unfortunately, for our rural patients. There's a massive potential for programs like Promote to be used with chronic pain patients. With our clinic-to-clinic model, patients are able to get the specialist care they need, plus support from a local clinician. This means the patient can remain in their community, surrounded by familiar faces to decrease burden and increase support. The literature has shown that patients who have close social support, or in this case, do not have to leave their support systems, have better outcomes. Patients who have their friends and family near have less pain intensity, less reliance on medication, greater activity levels, higher likelihood of long-term success, better disease management, decreased depressive symptoms, and improved functional abilities. Additionally, I mentioned earlier about multidisciplinary care. Having virtual care can allow for that multidisciplinary care to occur all in the same appointment, with doctors just joining from their various locations via some sort of video conferencing platform. Virtual care is the future, so why not make it the future of pain management too? Thank you so much for the opportunity to share our work at this amazing event. References are listed here, and if you have any questions, please feel free to email me at any time. Thank you so much.